Hello.
Thank you very much for having the time to speak to us. Byline Scotland, that is a citizen journalism, and we are very, very interested in always reporting all the matters that is very important for our citizens. And I think what I've seen today in your release is very important indeed. So, if you don't mind, would you be able to tell us a bit about your charity?
Of course. So we're Asthma and Lung UK Scotland. We represent the 1 in 5 people living with a lung condition in Scotland right now, and that might vary between people with asthma, a very prevalent lung condition, through to conditions like COPD, chronic obstructive pulmonary disease, typically thought of in terms of smoking or air pollution, and then through to maybe rarer conditions like idiopathic pulmonary fibrosis, which affects about 2,500 people across Scotland. So it can range quite a lot, but ultimately, around about 1 in 5 people are affected in some way by a lung condition in Scotland. So most people know someone affected in some way by one of our conditions.
It's unbelievable, isn't it? It's a lot. And when we compare what the government has been doing in terms of the central government and the Scottish government, how do you think are both, okay, I know that it's not being done enough, but how do you think Scotland is at the moment?
Yeah, well, I think the evidence we have would show that we still have a long way to go to tackle respiratory deaths and respiratory emissions with across Scotland. And we put out some data today, mapping different parts of the UK and showing what we call a lung health lottery. And as part of that, out sort of looking at the 10 worst performing areas in terms of
Mhm.
respiratory admissions and deaths. 3 of our areas in Scotland feature in that, and those are Inverclyde, North Ayrshire, and East Ayrshire. Um, and the challenge we're finding is that is people, particularly in areas with traditional industrial heritage or relatively high smoking rates, have higher prevalence of lung conditions, higher admissions into hospitals, and sadly higher deaths. And every respiratory death is avoidable, and with better support and self-care for people living with lung conditions, often these things can be avoided many years before. But we need support in the community to make this happen.
Yes, exactly. And then community needs to know well about this. And I was surprised actually, and I can be completely wrong, sorry if I'm being totally ignorant.
I'm sure you're not.
I've seen the data and I was surprised to see how East Ayrshire, North Ayrshire, it's considered one of the worst in Scotland. And when I think about Glasgow or East End of Glasgow and those tenements, and I was quite surprised that it's not one of the worst areas.
Yes. No, absolutely, and it's a difficult one. I mean, Glasgow is certainly up there in terms of having some of the highest prevalences of asthma and COPD in Scotland. And you're absolutely right that we have much higher levels now of the lung conditions in Glasgow than we do, for example, in Edinburgh. But I think because we're looking not at prevalences, but we're looking at the actual your trajectory and outcomes. So there's a few things at play here. So as well as the how many people have a lung condition, you're looking at the access to hospitals, what the
That's
support
true.
looks like in the community. Glasgow, for example, has the Greater Glasgow, Clyde, I should say, have very good community respiratory teams because it's a very big health
Yeah.
board with a lot of resource. So we're very good at Glasgow at supporting people in the community. So that's probably one of the factors at play here as to why people are performing better in Glasgow than they would be, say, in Ayrshire, where we haven't got that level of support. We haven't got a pulmonary rehab service which is as good as Glasgow down in Ayrshire. We've got great staff, but not enough of them. So all these issues are factors. So it's not necessarily as simple as the most urban, the most deprived communities having the worst outcomes.
And that is really interesting to know, yes, because at first you just think about these tenant
Yeah,
conditions, pollution, and we think about the big, we forget about the bigger picture, actually.
yeah.
And I can imagine how all of this got worse with COVID and with the pressure that the system nowadays faces. So it's hard.
It is hard, and I mean we're still working through that in terms of the long term outcomes of of COVID on people. So society as a whole across Scotland, we've seen huge amounts of deconditioning for people, not just with lung conditions, but all kinds of chronic conditions. People being less fit, less active, doing less because of their shield. Because we have people still now shielding and having very limited lives. They've
Mm-hmm.
we're 2.5 years since Scottish government said you can stop shielding now. But for these individuals, they are still operating as if COVID could take them any day now because of their vulnerability. It's not many people, but people with very, very severe lung conditions do live like that. So I know people with other conditions like certain types of cancer, which would in a similar category, being very, very careful because it's exposed not just COVID, but also the risks of flu and other respiratory viruses out there, which could lead to someone being hospitalized. So there are challenging factors out there. And since COVID, we've still got challenges and gaps in our community respiratory teams. We still haven't managed to fill all the staffing gaps. There've been restrictions on where pulmonary rehab can take place because of social distancing issues still. And we know that the whole process of diagnosing lung conditions has been affected because for 2 years no one wanted to do spirometry, which is a breathing exercise that you use to diagnose a condition. No one wanted to touch that because it was seen as an aerosol generating COVID dangerous procedure. So, and that legacy still remains in primary care. So we've got huge challenges, but some of these issues though, but the main factors though go much further than COVID. It's our industrial heritage. It's where people may have been smoking very heavily for a very long time, and they might have stopped maybe 10 years ago potentially, but the risk factors are still there because they smoked for so long before.
Mm-hmm.
So all of these things multiply to give us these areas and places like Inverclyde and North and East Ayrshire. We have still got historically relatively high smoking rates, and we still have particularly in Inverclyde, a huge industrial heritage.
Yes, true, definitely. Yes. And while you were speaking there, and suddenly came into my mind when we were thinking about the habits and then smoking. And nowadays we have to worry with our teenagers as well, with the e-cigarettes that seems to be becoming so trendy. So this is not helpful at all as well, and we should have a good campaign to interrupt this kind of easy access, if I can say like that, to e-cigarettes.
Well, we don't yet know the long-term impacts of e-cigarettes on young people, and that is a challenge. And it's something that we know it's something that worries Scottish government. It worries individual MSPs, and we know healthcare professionals and of course parents, worry about this. And e-cigarettes have got their place in terms of stopping people from smoking, and obviously people, if you're trying to support someone who's been smoking for the last 20-30 years, and whether they have a lung condition or maybe they are at high risk of getting a lung condition, an e-cigarette might be the way for them to quit, and that's what they were designed for. But obviously what we don't want is to see young people who've never smoked or even who vaguely dabbled in smoking suddenly embracing e-cigarettes as a positive lifestyle choice, which clearly it's not, and we don't know the long-term implications as to people.
Exactly.
If they are very addicted to these devices, would they turn to tobacco in the long term? Are there going to be long-term health implications because of vaping on its own? And there are some examples of that, but it is it is a very mixed picture. So yes, it's something I think on a lot of people's minds, and a lot of even some of the big papers are concerned about it as well. So we will have to see where it goes though, and but certainly it's not something to be encouraged.
Definitely, definitely, because I can see around it's like 13 years old,
Hmm.
all of them with e-cigarettes. It's worrying because it's exactly what you said is long-term effects. Now tell me, do you have any plans, like any next plans to make the bigger impact on how you could even help further to help people?
Yes. So 2 years ago now, the Scottish Government published its respiratory care action plan, and we're working with Scottish Government before that to develop it, and since that stage to try to implement it. And we've got a long way to go. And our challenge is to try to make sure that Scottish Government and the next Scottish Government under a new First Minister, new Health Minister, actually delivers on this stuff, because at the moment we have their bold aspirations from government, but as the data shows, we have huge challenges across different parts of Scotland, and we need to get on top of these. So we will continue to work with Scottish Government to actually deliver on the promises that they have made, and to make sure that and to keep pushing for health boards to have the resources that they need in local areas to be treating respiratory conditions in the community. Because if we can get better at supporting people earlier and closer to their homes, and actually empowering them to look after themselves, then actually we can avoid those hospital admissions, we can avoid those deaths, and we can transform people's lives. We can do that without a single trip to an A&E unit. So those are things we need to work on, and we'll continue campaigning and working with Scottish Government to make sure that people with lung conditions, wherever they live, whether it's from the Shetlands down to the borders, get the support they need.
Definitely. It looks like, as always, that we need a shift in how our health services work or think that is dependent on the government policies. Like, we need precaution instead of having this idea as let's have cure, because it's not only affect the lives of thousands of people, but it's much more expensive treating than avoiding. So we really need to stress this and try to change the government policies around us.
Yeah, absolutely, and in particularly conditions like asthma, for example, by far the most prevalent lung condition in Scotland. The vast majority of people with asthma, should be able to live a life not held back by their condition, by good use of their medications. And for most people, that medication will be their daily preventer inhaler. But we have an awful lot of people out there who are not taking those inhalers. They think they don't need them. They think they can rely on simply a reliever inhaler. If they get breathless, they'll puff the reliever inhaler instead. And that's really dangerous. That's really bad management of asthma. So helping people, supporting people to actually use their medications properly, and be empowered to do so is really, really important. That's why, at the very least, we need people with asthma and COPD to be having annual reviews with a GP or practice nurse, so they can go through their medication with them. They can talk about their condition. They can talk about any changes in the condition, and by good medication management, relatively cheap medication management, people's lives can be kept healthy and well and out of harm's way, and that's far better than having to have a scary admission to an ambulance, to an A&E department, which is the last thing anyone wants, and is incredibly dangerous and incredibly expensive.
Yes, no, definitely. It's really, really hard. And then we think about continuous supervision, if I can say like that, supervision. We fall into another problem that is continuity in treatment, because we normally change doctors all the time.
Yes.
So the system is kind of broken into pieces. We need continuity.
Yes. No, that's a good point.
Right. Thank you very much. It
It's
was a
okay.
quick one, but I think we covered well. But I'm really,
Last,
I'm really thankful about you taking a bit of your time to do this.
fine, no problem at all. I'm sorry for keeping you. But that's absolutely fine. And thank you for showing interest in the story. Yeah, happy to help. And I absolutely adore your background. I think it's lovely seeing that bridge. Which this I think that's the famous Harry Potter viaduct, isn't it? I think so. Very very impressive. But yeah, no, thank you. We look forward to seeing it. So thank you very much.
Okay. Thank you very much indeed.